नमस्कार. प्रुडंट मिडियाच्या हॅलो दोतोर कार्यावळींत तुमकां सगळ्यांक मना काळजासान येवकार. तुमकां येवकार दितना आमी येवकार दितात आमचे जे आयचे एक्सपर्ट आसात डॉक्टर अविनाश आनंद, ऑन्को सर्जन फ्रॉम विक्टर हॉस्पिटल. आनी विशय आसा रायझींग केसीस ऑफ कॅन्सर इन गोवा. गोंयांत कॅन्सरचें प्रमाण खूब वाडत आसा. हाचे विशीं आमकां कितें दिसता डॉक्टराच्या नदरेंतल्यान आनी कित्या खातीर केसी वाडटा, कशा रितीन आमी हें आव्हान पेलूं शकता हाचेर विस्कटावन चर्चा करपा खातीर आमचे बरोबर आसा डॉक्टर अविनाश. डॉक्टर नमस्कार.
नमस्कार डॉक्टर, थँक्यू.
बेसिकली आमचे डॉक्टर आसात ते खूब कडेन पयलीं शिकून आयल्यात, ते हैदराबाद शिकल्यात आनी तांच्यांनी बेंगलोरूय प्रॅक्टीस केल्या. आतां सध्या ते गोंयांत आसात एज अ ऑन्को सर्जन, म्हणजे कॅन्सराचे स्पेशलिस्ट अशे सर्जन, म्हणजे ते फक्त कॅन्सर केसीस हँडल करतात. तांच्या तोंडांतल्यान जेन्ना आमी कॅन्सरा विशीं आयकतात किंवा त्यांचे जे नवे मॉडेलिटीज ऑफ मॅनेजमेंट आसा ते खरें म्हणजे एक नवें लर्निंग आनी नवें शिकप अशें म्हणूं येता. आनी तुमच्या आमच्या सगळ्यांच्याच माहितीचें आसतलें तेन्ना म्हाका दिसता तुमी सगळ्यांनी हें मना पासून तुमी आयकतलेच. डॉक्टर, फर्स्ट ऑफ ऑल वेन वी टॉक अबाउट कॅन्सर, basically everybody is scared of the cancer. The word itself, the moment we hear cancer, whether he is educated, uneducated, whether he is doctor, engineer, whoever he may be, the moment we hear the word cancer, more than half our energy is gone.
Energy is gone. Very true, very true.
I should say. So basically what do you mean by cancer?
Sir, basically cancer, to make it very simple, I would say that every human body, the cells multiply.
Yeah.
And our body has something called as immunity. So body exactly knows when to stop the multiplication, when to destroy the multiplied cells and keep it under control. This is how the human body functions.
Achha.
But in some patients what happens because of smoking or drinking, the cells gets that special power to multiply in an abnormal way.
Achha.
It does not listen to any commands of the body.
Achha.
It keeps multiplying. 2 cells becomes 4 cells, 4 becomes 16, 32, and that becomes into millions of cells. And that forms a tumor.
Achha.
So that is what we call it as a cancer. Cancer is a state wherein the body loses the control to stop the multiplication.
So it is like something what we can say like population explosion.
Exactly, exactly.
It is going out of control.
Out of control.
So basically we want the people, we want the population,
Correct.
but it should not be explosion.
Explosion,
it should
very
be
true.
under control.
Under control.
So that the nation can progress and even the individual can also progress.
And
so that balance is lost.
Balance is lost. Body immunity is lost.
Achha.
Body fails to fight the multiplication.
So doctor, since we have chosen today's topic as a raising cases of cancer in Goa, I would like to know what is the prevalence of cancer in Goa and if you compare with the national level.
See, what is happening in Goa per se is like every year, 1,000 cases are increasing every year.
I see. 1,000 cases.
1,000 cases are increasing.
So in fact, it should be more than that
It is
because
more.
it's as on the record.
It is like a tip of an iceberg.
Correct.
So most of the times, based on records, what we see is a very superficial thing.
Absolutely.
But in reality, the number of cases are more, and a lot of patients are not coming forward. So the reality is actually very different, and the numbers are so very high, and that is one reason why we have come here to talk about the rising cases, what are the risk factors, what needs to be done to stop this number.
Yeah. Basically, doctor, one more question is that what I would like to know. So, which types of cancers are common in Goa? Since we are talking on this topic, anyways, I really appreciate because today when we talk about cancer and its management, it is not only government institution but even the private institutions have come forward. And Goa government has come with a very beautiful scheme of DDSY. Pradhan Mantri scheme is there, and all these people, nobody should suffer because of lack of money. This is a one-point program, and everybody should come on time to the nearest hospital, whichever possible, which are empaneled under this, and they should get a proper treatment.
Very
so
true,
really, I think Goa government has done a tremendous, fantastic work, and all of you have come forward. It is also to be appreciated. Doctor, you tell me which type of cancers are common in Goa?
See, I'm working here in Goa for the last 2 years. In my practice, what I have seen among females, breast cancer is very common. I think one very dangerous fact what I would want to mention is all of my patients, see when I was working in Hyderabad, all my breast cancer patients, the age was above 50 years.
I see.
All were elderly patients. But in Goa, what is happening, all my patients are young patients. You come to Victor Hospital, I think now my the chemotherapy what I'm giving, the surgery, all are 30 years, 34 years, 28 years. I think one patient whom I operated 2 months back, she was only 26 years.
My God.
So a lot of young female patients are getting breast cancers. Among females, I'm talking about. And in male patients, I would say the GI cancers are more. Especially pancreas, liver cancers, stomach cancers, and the colon cancers and the rectum, the intestine cancers. I think probably I would say maybe because of the lifestyle practices, sometimes drinking is a major risk factor. I think that can be attributed to it. But in Goa per se, I think the GI cancers are more in number among male patients and breast cancer among female patients, that too young patients.
Okay, doctor, just academic twist.
Ha, ha, ha.
Basically, when you say about GI, this is more of a lifestyle diseases or disorders. How you'll explain the cancer, breast cancer, among prevalence of breast cancer higher in the younger age group in Goa?
Goa. See, one thing, definite reason for that is because of the family testing is not done here. See, what happens is like one thing what I've observed is a lot of young female patients, they have a strong family history.
Oh.
Their mother had a breast cancer, their grandmother had a breast cancer, which says that there is a genetic damage.
Acha.
So none of these patients are getting it checked. So when a genetic testing is not done, it is like a virus. It keeps spreading from one family to the future family. So I think that is one major reason. Other reason for breast cancers among young females is because of late marriages. Sometimes when you get married above 30 years, so the hormonal levels are very high, the estrogen hormone. That itself is a risk factor. And sometimes when you get married and you're not having children for a long time, some people are married and they're not willing to have children. That is again a risk factor. And sometimes a lot of females, they don't breastfeed their babies. They breastfeed for maybe 1 month, 2 months, and they stop breastfeeding the babies. So breastfeeding is a very protective thing. When you don't breastfeed your babies, the risk for breast cancers are very high among young female patients. So these are some of the factors, attributes to breast cancer.
दोतोरान जे गजाल सांगल्या ती हांव मातशी कोंकणीन तुमकां सगळ्यांक कळची म्हणून सांगता आनी म्हाज्या खातीर दिसता की खूब म्हत्वाची आसा. गोंयांत ब्रेस्ट कॅन्सर म्हणजे स्तनाचें कॅन्सर गोंयांत खूब कॉमन आसा अशें तांचें मत. आनी ते कित्या खातीर हाचे जेन्ना हांवें तांकां प्रश्न विचारलो तांणी सांगलें की एक म्हणजे लेट मॅरेजीस, म्हणजे खुबशीं चलयां लेट म्हणजे खूब वय वाडल्या उपरांत म्हणजे 25च्या उपरांत अशें लग्न जातात. खुबशे फावटी तांकां बेगीन भुरगीं जायनात, मे बी बाय दॅट चॉयस ऑर वॉट एवर द सिच्युएशन. तिसरी अशें आसा की ती ब्रेस्ट फीड करनात, म्हणजे भुरग्यांक दूद आंगावयलें दिनात. आणि टू बी व्हेरी फ्रँक, हेच ताणें कन्क्लूड सांगतना एक कन्क्लुजन करतना एक निश्कर्श मांडला की ब्रेस्ट फिडींग जें आसा ते आवय जेन्ना भुरग्याक दूद दिता तेन्ना भुरग्या खातीर तें म्हत्वाचें आसता. त्याच प्रमाणे ते आवयक एक राखण दिता, एक प्रोटेक्शन दिता, स्पेशली अगेन्स्ट प्रॉब्लेम्स लायक कॅन्सर. म्हाजे खातीर हो म्हत्वाचो सल्लो आसा, तुमी सगळ्यांनी तो लक्षांत घेवचो. वेळार लग्न जावचें, वेळार भुरगीं जावची आनी वेळार भुरगीं जाल्या उपरांत तुमी वेळार तांकां जशें आमचें प्रिस्क्रायब शेड्यूल आसा एटलीस्ट कमीत ते 6 म्हयने आंगार दूद दिवप आनी मागीर जो म्हणसर भुरगे दूद घेवं शकता किंवा तुमी दिवं शकता तो म्हणसर कंटिन्यू करप, हें सामकें म्हत्वाचें. ब्रेस्ट फिडिंगाच्या ऐवजी तुम्ही जे आता टीन फिडिंग किंवा भायले जे बॉटल फिडिंग आसा ते मात पासून वापरचें न्हय. हो म्हत्वाचो सल्लो म्हाका दिसता तुमी सगळ्यांनी मतीन दवरचो. आनी हो प्रश्न फुडें व्हरतना, इज देर एनी अदर थिंग्स यू फील अबाउट इन द जेंडर दिस थिंग दॅट ओके वन मोर थिंग सिन्स यू हॅव टॉक्ड अबाउट ब्रेस्ट कॅन्सर, देर आर सम इन्सिडन्सीस ऑफ ब्रेस्ट कॅन्सर इवन अमंग द मेल्स. What is your take on this?
Yes. Breast cancer can also occur in male patients. The only difference is like it is very rare. And sometimes in male patients, when they have some medical problems, like the estrogen hormone levels are more in some male patients. That is a risk factor. And if the male person is having a family history of breast cancer, even he can develop. So usually the family history is a risk factor, but the incidence are very low. But breast cancer in male patients are very bad, unlike the female patient, because it spreads very fast. But I have come across, I think 2 cases I've operated in Victor Hospital, young patients, again 35 years old, and they had come with a breast cancer. So that is also, not many people are aware about it, but it can happen in a male patient.
डॉक्टरांक आम्ही विचारलं की हे दादल्यामध्ये जाऊ शकता का म्हणून, ताणें सांगलें हय, आनी खुबशे फावटी ते यंग दादल्यामध्ये ब्रेस्ट कॅन्सर जावं शकता. सगळ्यांच्या मतीन आसुनी, कारण जेन्ना एखादो दादल्या मनशाक समजा अशें कितें गूट लागता किंवा कितें प्रॉब्लेम आसा ताणें वेळार डॉक्टरा कडेन वचून तज्ञ दोतोरा कडेन वचून सल्लो घेवचो. हे आमचे म्हत्वाचे जे मार्गदर्शन, म्हणजे बेसिकली हे कार्यावळीची मोखच अशी आसता की लोकांक कितें तरी ज्ञान मेळचें. आनी म्हाका दिसता हो म्हत्वाचो रोल तुमकां सगळ्यांक कळ्ळो आसतलो. आणि त्या दृश्टीन तुम्ही एक विचार, कारण आमकां दिसता की ब्रेस्ट कॅन्सर म्हणजे स्तनाचो कॅन्सर म्हणजे फक्त बायलांक जावपाचें दुयेंस, दादल्यांक जावं शकना. पण जावंक शकनाच अशें न्हय, तें जावंक शकता आनी डॉक्टरा कडेन केसीस आसता. एक गोश्ट आनी एक म्हत्वाची गोश्ट सांगली, आमी एक कंपेरेटिव्ह स्टडी तांणी सांगली की गोंया भायर जे लोक आसात तांकां चडशे 50 वर्साच्या पिरायेच्या उपरांत ब्रेस्ट कॅन्सर किंवा स्तनाचे कॅन्सर जातात. गोंयान यंगर एजीर म्हणजे 20 म्हणजे 30 आनी ह्या ग्रुपानूच चडशे कॉमन आसात. ताचें उत्तर आमी तुमकां ऑलरेडी सांगिल्लें आसा कित्या खातीर, आनी हाचेर तुमी सगळ्यांनी एकदां गंभीरपणान विचार करप तितकेंच गरजेचें आसा. म्हाका दिसता हो म्हत्वाचो मुद्दो तुमी सगळ्यांनी लक्षांत घेवचो. डॉक्टर, वेन वी आर टॉकिंग अबाउट genetic factors, and you have rightly said, okay, there are some cases in families it runs. Now you tell me, what are the risk factors, how we can identify, and what are the, what I should say, like tumor markers or whatever you would like to call it, so that the person is aware that she or he is likely to get, or in an initial, so that they can take the best care.
Correct. So normally what we do is, for that the person has to first come forward. They have to come and meet the oncologist, not any other doctor.
Correct.
So once they come to me, what I do is I take a proper family history. I'll try to see how many people in their family had cancer, what type of cancer they had, and every cancer has a certain genetic mutation, that is genetic damage. So once I feel the risk is more, we collect their blood sample and then we send it for a genetic testing. So usually the report takes about 21 days time, and we check for not only that particular cancer, we check for the gene which can cause all types of cancer. Suppose if the gene comes as positive, then what we do is we tell the patient that you are a very high risk candidate, and we put them on regular follow-ups. Follow-up scans will be done. For example, we can do a mammogram, ultrasound or MRI scan, and then we give them some tablets also to prevent. There are, yes, for breast cancer we put them on a tablet for certain years, and we put them on a regular follow-up. And if any cancer, if there is any risk of coming back again, then we advise the treatment part. So it is very important that when a genetic testing is done, at times you can prevent the cancer.
I see.
And the testing is very simple. All you have to do is just give a blood sample, and so that the rest of your life you can live peacefully without having any tension. I have a lot of patients where even doctors, they call me up from other cities saying that my father died because of liver cancer, my mother died because of breast cancer, and they are with so much of anxiety and depression because every day they think that something goes wrong, they think it's a cancer. So I tell them clearly, if you're so worried, get a genetic testing done, and that will give you a clarity.
सो म्हाका दिसता आनीक हो खूब म्हत्वाचो मुद्दो आसा. डॉक्टरान आमकां म्हत्वाचें सांगलां की हें आमच्या सगळ्यां खातीर म्हत्वाचें आसा की खुबश्या फॅमिलींनी जेन्ना कोणाची आजी किंवा आवय हांकां जी फॅमिली हिस्ट्री आसता एखाद्या कॅन्सराची, एखाद्या पर्टिक्युलर कॅन्सराची, तें दुयेंस किंवा तें कॅन्सर त्या भुरग्यान येवं शकता किंवा त्या जनरेशनान येवं शकता. बट एक म्हत्वाचो आनी बरो आशावादी दृश्टिकोन असो आसा की ताका जेनेटीक टेस्टिंग करून आमी हें कळूं शकता की बाबा हाका हें कॅन्सर जावं शकता किंवा जावपाची शक्यता आसा वेल इन एडवान्स. दुसरें म्हणजे समजा अशी सिच्युएशन आसा, जर एखाद्या फॅमिलींतल्या हिस्ट्रीन त्या यंगर जनरेशनाक त्या नव्या भुरग्याक तें म्हणजे जावं शकता, जाल्यार ताका वेळार वखद दिवं शकता. प्रिवेंटीव मेडिसिनी आज थोडीशी आसात जी दिवं शकता, ताचो हेल्प जावं शकता. आनी टायम टू टायम फॉलोअप, जशें आमी म्हणटा की डॉक्टरान सांगलें की मॅमोग्राफी एक 6 म्हयन्यांनी किंवा आनीक ज्यो कितें टॅक्नॉलॉजिकल सपोर्ट सिस्टम आसा तेचो आदार घेवन जर एखादें दुयेंस आमकां वेळारच कळ्ळें जाल्यार ते वेळारूच मॅनेज करूं शकता, सो दॅट द कॉम्प्लिकेशन डजन अकर अँड यू लिव अ व्हेरी हॅप्पी अँड हेल्दी लायफ. करेक्ट? So doctor, one more thing I would like to know. See, what type of, now you mentioned about the cancer in the breast. You said other cancers also can be identified by their genetic testing. What type of cancer? Like which are the commonly occurring cancers which you can identify?
One is breast cancer we can pick by genetic testing, and even GI cancers, like cancers of the colon. So there are certain genetic markers for that, and even ovarian cancers also can be because of the same genetic damage. So very few cancers we have a protocol and the guidelines which has a strong genetic spread. So that we assess the patient and then we get it done. But certain cancers like you take in females only, when I talk about cervical cancer,
Correct.
I think that is the second most commonest cancer in India, especially developing countries.
Absolutely.
Because I think even educated people are not going forward for a Pap testing. So certain cancers, just by doing simple testing like a Pap smear, you can completely prevent or you can treat cervical cancer. That is again
So
one more
since you diagnose right in time.
right in time. So I think among females, I would always mention that all females should be very careful about breast cancer and cervical cancer. If you're above 40 years, every year you have to get a mammogram done. And if you're above 21 years, you have to get a pap smear testing done once in 3 years. The moment the female becomes sexually active, you have a chance of developing cervical cancer. That is why in Victor Hospital, we are stressing more on giving vaccination for cervical cancer. Even the
Okay.
government has taken an initiative.
Yes.
So we need to fight cervical cancer and prevent it. That is a very major cancer where death is very common.
हे आनी एक म्हत्वाचें आमच्या खातीर मेसेज किंवा सल्लो आशिल्लो की आज खुबशे फावटी आमकां सर्वायकल कॅन्सर म्हणजे बाकी बायलां मनशाच्या जो गर्भाची पिशवी आसता ताचो सकयल्या भागाचो कॅन्सर कॉमन आसा. तो कशा रितीन आमी आडोवंक शकता हेचे म्हत्वाचे डॉक्टरीन सल्लोय आमकां दिलो आसा. 40 वर्साच्या उपरांतचे बायलेन चडशे फावटी मॅमोग्राफी इयरली वर्सान करून घेवची आणि 20 वर्साच्या वयल्या चलयांनी 3 वर्सांनी तरी पॅप स्मेअर करून घेवचे एवरी
Correct,
3 इयर्स
correct, yes.
सो दॅट इट इज पिक्ड अप अर्ली. आणि जेन्ना तुमी ते बेगीन पिकअप करता तेजे ट्रिटमेंट ऑलमोस्ट सिंपल आसता. इट नथींग मोर ते म्हणजे ताका व्हडलें रॉकेट सायन्स न्हय. पण वेळार डायग्नोज जावप म्हत्वाचें आणि वेळार डायग्नोज करतले जाल्यार पॅप स्मेअर टेस्टिंग सर्वायकल कॅन्सरा खातीर म्हत्वाचें. आनी ताणी म्हत्वाची माहिती आमकां सांगल्या की आजकाल नवे इंजेक्शन्स आयल्या जाका उद्देशी आमी ते भुरग्यांक म्हणजे चलयांक जर बिफोर दे बिकम सेक्शुअली एक्टीव म्हणजे शारिरीक संबंध येवच्या पयलीं पासून जर तांच्यांनी ते इंजेक्शन घेतले जाल्यार तांकां सर्वायकल कॅन्सर जावचो ना. आणि हें खूब म्हत्वाचें आसा. त्या दृश्टीन सरकारचे प्रयत्न खूब आसात आणि आमी सगळ्यांनी मेळून ह्या कार्यावळीक हातभार लावपाक जावो. तेन्नाच कारण दिस इज वन ऑफ द लिडींग कॉज म्हणजे गोंयानूच अशें न्हय तर देशानूच सर्वायकल कॅन्सर प्रमाण खूब आसा. And doctor, one more thing which I always say, most of the times females, those who get breast cancer or cervical cancer, they basically get some signs and symptoms, but they always hesitate to go to doctor.
Correct,
And
correct.
one of the commonest reason is that it doesn't pain.
It doesn't pain.
It
very-
doesn't pain. तुमचं दात दुखता केसोळी जाली तुम्ही रोखडेच दोतोरा कडेन वता. पण समजा जर छातयेन किंवा ब्रेस्टान जर तुमकां ल्हानशें गूट लागता जाल्यार तुमी दोतोरा कडेन वचना. दे ट्राय टू कोरिलेट विथ नो आपूण ल्हान आसतना पडिल्ले हॅड फॉलन ड्युरिंग माय दिस
Correct,
थिंग
correct.
नो माय सन हॅड डॅश्ड वन आय हॅड
Correct.
फॉलन ऑन द टेबल मीन्स समथींग दे हॅव दर ओन लॉजिक्स. हें अशें करूं नाकात. आमी परत परत सांगता प्लीज डोंट डू दीस. द मोमेंट यू फील समथींग आणि जशें आमी आनीक सांगता की दर म्हयन्याच्या उपरांत बायल मनशान पाळी जातकूच आपल्या स्तनाची स्वता तपासणी करून पळोवची. इट इज नॉट अ बिग सायन्स. स्वताच्या हातान तपासो. डॉक्टर यू कॅन ऑल्सो एक्सप्लेन टू अस लायक हाऊ दे शूड डू द ब्रेस्ट एक्झामिनेशन.
Yes. See what happens, as you clearly said, among females, breast and cervical cancer stigma is more.
करेक्ट.
I'm telling this very openly because my patients who come to me, they're very shy, very hesitant. Sometimes, so many reasons, they don't open up.
करेक्ट.
Till it becomes a major problem. See, I had one patient with breast cancer. It had turned into an ulcer, and she didn't want to go for any treatment.
Absolutely.
And her Guruji told that don't go for any treatment. Everything will disappear. And when she came to me, worms were coming out.
Oh my
It was
God.
smelling and worms were coming. So this is what is happening. So sometimes, not always cancer tells you and come. See, there are cases wherein the patient can have only pain in the breast.
करेक्ट.
There may not be a swelling.
Absolutely.
And that can also be a sign of a breast cancer. Sometimes breast will be normal, but swelling can be in the armpit. That can be advanced breast cancer. Sometimes one just single drop of blood can come through the nipple. And that also can be a breast cancer. Sometimes only the skin can change. The skin can be very thick, or there can be
Like
lot
orange
of
skin.
like a orange skin. That is also one of the major signs of breast cancer. So that is why it's all about education. You should every female should read the various presentations. It is not only the swelling which can cause cancer, but cancer can always trick you.
Correct.
It can come in different presentations. Same thing when I want to talk about cervical cancer, it is usually bleeding from the vagina. Sometimes, a lot of times, females complain of pain during sexual activity. That is one of the major signs. Sometimes what can happen that discharge can be very foul smelling. So that is also one of the warning sign. And sometimes we need to understand that there will be no signs at all. You will start losing weight. That will be the only sign of a cancer. So I think it's all about education. The main purpose of me telling this is because we have to know what are the various signs. If you don't know the warning signs, then you cannot pick up cancer at an early stage.
सो म्हाका दिसता दोतोरान खूब सामकें सुंदर तरेन एक्सप्लेन केला की ब्रेस्ट कॅन्सर जाता तेन्ना दर फावटी तुमकां तें दुखतलें तशें न्हय, तें दुखूं शकना, केन्ना केन्ना दुखना पण ताचो ऑलरेडी लंप आसता, केन्ना केन्ना लंप आसना पण दुखता, शारिरीक संबंद दवरतना दुखता तेन्ना सर्वायकल कॅन्सर आसूं शकता, डिस्चार्ज आसतलोच किंवा अशें न्हय पण केन्ना केन्ना फावल म्हणजे वास मारता जे तुमी आंगार तुमकां जाता तेन्ना किंवा तांबडेच जाता पण ते परत परत जाता, खूब फावटी जाता. अशा सगळ्या सिच्युएशनांनी म्हाका दिसता द बेस्ट एडवायस एज डॉक्टर रायटली सेड, गो टू द रायट डॉक्टर अँड गेट युअर सेल्फ इवॅल्युएटेड ऑन द मेडिकल ग्राउंड. तुमी स्वताचे अशे अंदाज बरोवन ना एका तशें जाल्लें तिका तशें जाल्लें अशें करून रावूं नाका. सेकंड थिंग इज वर्ड ऑफ कॉशन ऑल्सो की अशें न्हय की दर फावटी तुमकां एखादें गूट आसा म्हणजे कॅन्सरच आसता अशें न्हय, इट कॅन बी ब्रेस्ट एडिनोमा ऑल्सो. सो बेस्ट थिंग गो टू द डॉक्टर, गेट प्रॉपरली इवॅल्युएटेड सो दॅट तुमच्या मनान भंय नाका आनी मनान टेन्शन नाका. जर कॅन्सरचे दुयेंस योग्य वेळार ताचें निदान जालें जाल्यार 100% बरें जावं शकता. दॅट डॉक्टर हॅज ऑलरेडी एक्सप्लेन टू अस. म्हाका दिसता ह्या खूब म्हत्वाचें आसा. डॉक्टर वी हॅव गॉट अनदर 2-4 minutes. सो वॉट यू वूड लायक टू टॉक ऑन दीस सब्जेक्ट एज द टेक होम मेसेज एंड हाव यू वॉन्ट टू गो टेक दीस टॉपिक ऑन अ हायर स्टँड, you can take it.
Yes. See, my straightforward advice, I think one thing which I feel very sad about all my patients who come to the hospital is they all come at a very late stage. And I feel very sorry for them. You cannot blame them because they go to different doctors, they try different modalities of treatment. See, everyone wants simple treatment. If I tell them you have to undergo surgery, nobody wants it.
Correct.
They want to try medicines, they want to try their own way of managing it. That is where we are losing the patient.
Correct.
That 1 month, 2 months of time period. So my advice is always go to a super specialist. I would say that. See, when you have a heart attack, you have to go to a cardiologist.
Correct.
When you are suspecting cancer, go to a qualified oncologist because every treatment of cancer will remain the same. There is no experimentation, nothing. So you have to take the right treatment at the right time. But 90% of the times the treatment is like all varied and we are losing patients mainly because of that. That is number one. Number two is it's a patient's education. Lot of times people read Google and they misinterpret something else.
Correct.
So never treat your own self. Anything which you have a doubt, go to the doctor and always get it examined. And other point what I want to mention is the lifestyle modification. See, you take an example like people who live in the villages. They have no cancers. There are no hospitals in so many places. So how do they live for 90 years, 100 years? It's because of the lifestyle what they practice. So too much of westernization, too much of drinking, smoking, and eating a lot of red meat. I would say red meat, which has got too much of oil. These all are proven risk factors. That's why when I go to a lot of colleges and when I give a talk, I tell them it's very simple. You change your lifestyle, you are going to live a very happy life. So I tell this point, the first 30 years of your life is a gift from the God. The next 30 years of your life depends upon how you have lived your first 30 years.
Oh.
So that is how it goes. So it's purely lifestyle modifications. You have to cut down alcohol, stop smoking, and take vaccination. There are certain cancers which you can prevent, like cervical cancer, take a vaccination, and breast cancer, regular screening, and consult your doctor. All I can tell you is, don't judge yourself. Take off that stigma. Be very practical, very bold, and share your problems. Doctors are always there to help the patients.
So, doctor, we have got another almost 1 minute. What is the role of counseling in this?
See, counseling is very important because when I talk to a patient, I sit down and I talk for half an hour. I don't rush into my treatment. I understand their problem, and oncology per se is a huge thing. Psychologically, patients get depressed. There are cases where patients have committed suicide after we telling them that you have a cancer.
Correct. In fact, that is a oncopsychology independent subject.
Yes. So that is why in Victor Hospital we try to counsel all cancer patients. We do a pre-operative counseling, assess their mindset, we assess their family status, what are their family commitments. And after surgery, we'll try to help them rehabilitate. So it's a long process. I think this all can happen in a setup where you have the facilities, and that is how the treatment also becomes successful.
Okay, doctor, thank you very much for sparing your precious time. म्हाका दिसता आयची कार्यावळ तुमच्या माहितीन, तुमच्या मनान बरीचशी तुमकां इन्फॉर्मेशन मेळ्ळी आसतली, माहिती मेळ्ळी आसतली. ह्या सगळ्या माहितीचो पॉझिटिव्ह रितीन उपयोग जावचो, तुमकां सगळ्यांक बरी भलायकी मेळची अशें मागून आयची कार्यावळ सोंपयतना तुमकां सगळ्यांक मना काळजासान देव बरें करूं. नमस्कार. थँक्यू डॉक्टर.
Thank you so much.